Alright, I'm going to do the abdomen test. So first I just start with an overall inspection, so I just observe the area for symmetry, contour of the skin, and discoloration, note any scars or anything. From there, yeah, and I especially look for like any visible masses or herniations. From there I move on to the auscultation. And this absolutely must be done before any other procedure. So I first start with the diaphragm of the stethoscope, and I listen to the 4 quadrants, and you listen to each spot for about 2 minutes. Just listening for abdominal sounds, mostly for digestion is what you should hear. But especially listening for anything abnormal. So then I would move on to and listen with the bell for friction rubs over the liver and the spleen. Yeah, just listening for any, especially friction rubs, and asking if they have any pain with that, because that is especially when you listen for those friction rubs. Then I am going to listen with the bell for bruits. First start just with the abdominal aorta, and which is just superior to the umbilicus. And then move on to renal, and then listen to the iliac, which is between the ASIS and the umbilicus, and then listen to the femoral and flip the top of their pants. Alright. So now I'm going to move on to percussion. And I'm going to first percuss the abdominal area from the subcostal margin through the pelvis, just basically moving in the 5 lines. And asking if there's any pain with any of that. And then I'm going to move on to percussing the margins of the liver. So I start from the top, basically at rib 6, and go down from there and wait until I can hear a dull sound and note where that is. And then I would move upward. Until I also hear another dull sound. Basically in making sure the liver is within a 6 to 12 centimeter range, and it would be. And then I'm going to percuss for splenic enlargement. I would go basically just under the rib area on the left side, and I would percuss in this area and ask if the patient has any pain with this. Is there any pain? No. And a change in percussion from tympany to dullness on inspiration suggests of splenic enlargement. So I'd ask the patient to breathe in and hold it. And does any of that hurt?
No.
Nope. So that rules that out. And now I'm going to palpate the abdominal area. So I would just start in circular motions, basically in the 4 regions, or just kind of moving clockwise. around the abdominal area. And then especially concentrate on the appendix area by the cecum. And is there any pain with that?
No.
So then I'd move and do deeper palpation in the same areas with 2 hands. And ask, is there any pain with that?
Nope.
Nope. Yeah, and especially, specifically looking for masses. Then I'm going to palpate McBurney's point. That's located between the ASIS and the umbilicus. So I would push and then take or pull off really quickly, and if that would indicate a McBurney's sign. If it was pain, was there any pain with that? No. So now I'm going to locate the edge of the liver. So I would go under the right side rib cage. So I'd ask the patient to breathe in and all the way out, and then breathe in again. And was there any pain with that?
No.
No. And then I'm going to attempt to palpate the spleen, which is very difficult because it's not an easy palpable thing. It should be not able to be felt, basically, or that can indicate some splenic problems. So I'm going to ask the patient to breathe in and out. Is there any pain with that? No. So that means his spleen is in normal order. So now I'm going to palpate the aortic pulse, which is superior to the umbilicus, using the bimanual technique. So I basically feel for the borders of the aortic pulse, and it should be no more than 3 centimeters wide. Yep, and it's about 2 centimeters wide. So that's within normal range. Now I'm going to attempt to palpate the kidneys, which is only usually able to be done in thin patients. So I reach under the abdomen, and then I palpate on the lateral border underneath the rib cage. And I can't really feel it on that side. And not really on that side either. So that should be normal. Was there any pain with that either? Now I'm going to check for rebound tenderness. There you go. Oh, and checking for Rothson's sign. So basically checking for left-sided pressure, which could suggest appendicitis. So I go on the opposite side of the appendix, and I push in and take off really quickly. Again, and did that hurt at all?
Nope.
Nope. So that means that his appendix is normal. So now I'm going to test for the psoas. I'm going to do active tests of the psoas. So I'm going to do the obturator test, and I'm just going to turn it in and out. Is there any pain with that?
Nope.
No. All right, and bend this one up as well. Internally and externally rotate it.
Nope.
Is there any pain with that? No. And now I'm going to have them test their psoas. So I'm actually going to have them lay on his right side. I'm going to ask the patient to extend the top leg backwards. And was there any pain with that?
No.
Nope. So that psoas right, and I'll have the patient flip over. And then have them extend their leg again. And is there any pain with that?
Nope.
Nope. So that means that their psoas is normal as well. And that concludes the abdominal test.